Hi, my name is Davita Price, and I'm a licensed psychotherapist and a board-certified music therapist in California. I specialize in working with individuals who are dealing with depression, anxiety, and trauma. I'm fully trained in EMDR, which is an evidence-based type of trauma therapy. Today, I'd like to talk a little bit about the trauma work that I do, so that if you were to come into a session or any session where you are hoping to do some trauma work, you might know what to expect. EMDR is short for eye movement desensitization reprocessing, and it was founded by Dr. Francine Shapiro. Traditionally, EMDR is 8 phases and uses eye movements through many of those phases to help a person stay present and grounded and help with the reprocessing. And when I refer to eye movements, it's just as if you were following somebody's finger from side to side, keeping your head straight and your eyes were moving back and forth. We've found more recently that this is a type of bilateral stimulation, and a lot of different types of bilateral stimulation help with the processing phases that use bilateral stimulation in EMDR. So other types of bilateral stimulation might be the butterfly position, which is tapping alternate sides of the chest, or alternate legs. I've also had clients play an instrument like the drum or even the piano. So bilateral stimulation is pretty broad, and you can use a lot of different things for that throughout the course of EMDR. What if you were to come into a session and want to do EMDR? The first thing that we would do is make sure that you have strategies to stay present in the moment and to shift yourself out of high activation. So sometimes when we bring up a traumatic memory that's very activating to the nervous system, and we immediately go into sympathetic or dorsal vagal, which is activation, fight or flight, or shut down. And so what we want to do is find strategies to pull us into ventral vagal, which is safe, connected, calm, adaptive. And so we want to identify those strategies before we do any trauma work, so that you have skills to move you from a place of activation to a place of maybe more calm, adaptability, a capability of moving on with your day once you leave our session. Once we've identified those techniques, then we are going to identify what it is we want to target. Now, if you're coming into a session with a very specific event that happened, like a one-time trauma, then we may already know what we're addressing. A lot of folks that I work with have complex trauma or have had many different things in their life happen. So at that point in the therapy, then we're wanting to kind of problem solve and identify either the earliest experience or perhaps the most difficult thing that's coming up for them in their life right now, and kind of work back from that. Once we identify where we want to start, I like to think of the analogy of a map. So imagine you have a map of the United States in front of you. You want to put a pin in the starting place, but then you also want to identify potentially a destination. So you have a starting place on the West Coast, you have a destination on the East Coast. In traditional EMDR, we would start with that starting place in your mind, and you would do the eye movements or the bilateral stimulation for a series of about 10 seconds, and then stop and check in with the therapist and see where your mind has gone. The mind can go anywhere on the map, and that's kind of part of what we're exploring, is where the mind is going to go and what does it need to go to heal and create an adaptive story about what happened. We check in and we put another pin on the map, and we keep going with this process of eye movements and checking in, perhaps doing a little bit of work around what comes up, but ideally, eventually we move across that map. Now, I have a lot of clients that come to me with high dissociation or other trauma responses that make it very difficult to even bring up the difficult memory or experience. And in those cases, and many others, we might use what I call, or what is called, the flash technique, but that has been developed more recently by Philip Manfield. In the flash technique, we don't need to let the brain explore. What we do is we identify that starting place, and then we roll up the map and put it away and focus on something pleasant. Now, while we're focusing on something pleasant, then about every 5 minutes, I would have my client blink 3 times. I know it sounds weird, but what it's doing is it's pulling that map back in front of us and allowing the brain to create a new association. And then we put the map back and we continue engaging in that pleasant association for 5 seconds. Blink again, pulling that map back in and allowing the brain to create a new association, then put it back. And so this is kind of a way of engaging the working memory to reprocess something very difficult without having to really activate the memory in the nervous system. So, of course, the flash technique is a good technique for a lot of different folks as well. If you have any questions, you're welcome to reach out to me, Davida at Rhythm and Resolve. If you're interested in scheduling a client consultation, you're welcome to do that through the scheduling widget on my website. Take good care.